name's David Ahn. I'm an adult endocrinologist. I work in Newport Beach, California. I'm really passionate about helping people with type 1 and type 2 diabetes. One of my areas of interest is using technology to help improve people's blood sugar control, but more importantly, improve their quality of life. When managing diabetes, I think it's really important that people have a choice because I think it's really important to pick tools that are compatible with your way of life. And the Eversense E3 offers some really unique advantages in its form factors. So the E3 lasts 6 months or 180 days. Most other sensors on the market have to be changed out every 7 to 14 days. So this 180 days is more than 10 times as long. That means a lot less supplies that you have to carry around. So for example, if you're going on a trip, you don't have to carry around all these backup supplies. It also means less times you have to puncture your skin because every time you change out any transcutaneous sensor means you're getting another puncture in your skin. So patients really like the fact that they don't have to have so many procedures and they can focus more on just living their life and not worrying about, the busyness of diabetes. So the E3 has incredible accuracy as a continuous glucose monitor. One of the biggest complaints I hear from patients is that they don't find their continuous glucose monitor to be accurate enough. It might give them, false notification of lows that aren't truly low. So having incredible accuracy like the Eversense E3 gives them more peace of mind and confidence that when they are alerted to a high or low blood sugar, that it's something that is real and something that they need to respond to. The overall process is very simple and straightforward. First, we drape the area, then we numb the area with lidocaine. After that, we start the process. At that point, the patient is done and we close the incision with steri strips as opposed to stitches, and patients really like that part. And then we pair the sensor and they're good to go. What patients really like about the Eversense E3 is that it's a totally different form factor than other CGMs on the market. This is something that is implanted under the skin, which means that you don't have to have a sensor penetrating your skin. That makes it possible to be able to take off your CGM and put it back on. No other CGM on the market has that flexibility. One feature that a lot of my patients really love about the Eversense E3 is that it's the only continuous glucose monitor that has on-body vibratory alerts. What that means is that the patient doesn't have to look at their smartphone, they don't have to necessarily look at a device to be able to know that their blood sugar is high or low. You might be in a meeting and want to be somewhat discreet. I have a patient in particular who really loves the Eversense because the vibratory alerts make sure that she gets up, which means that she doesn't have to bother her husband, which means that everybody's happy and patients love it. I really focus on two things. You want to improve your glycemic control and you want to make your quality of life better. And I think the Eversense E3 really helps with both of those. I think the Eversense E3 really offers advantages for every type of patient. But if I had to think of the most ideal type of patient, it would be the one that really values flexibility and wants to live their life to the fullest and have diabetes bother them less. I have patients that are flight attendants, firefighters, police officers, athletes, and they really like the fact that they don't have to think about it so much. If it gets knocked off, they can just reapply it. They don't have the freedom to look at their smartphone, they can feel the vibratory alerts on their body. And that type of flexibility really allows them to live their lives to the fullest, and that's why they really enjoy the Eversense E3.